Hi, my name is Dr. Rich Hilsden, and you're watching my channel, Knife Skills. Today we're going to talk about one of the most frustrating things after gallbladder surgery, and that is pain that you didn't expect after your operation. The real reason to have your gallbladder removed is to prevent future attacks and reduce future pain. So to have pain that you don't expect after your gallbladder surgery can be frustrating. And so I hope this video is going to give you a bit more context to understand what might be causing that pain after your operation. So let's break it down to a few categories. Number one, let's talk about mild pain after the operation. There really is no way to perform surgery pain-free. When you're cutting the skin to remove an organ and you're doing any procedure, there is going to be some pain as there is actual damage to the tissues. As a surgeon, we injure, then heal, and it's one of the challenges and joys really of doing this type of operation. Typically, that type of pain though is easily managed with over-the-counter pain medications. Some of the research that I've been involved in has demonstrated that Advil and Tylenol are really all you need to treat that type of pain after your gallbladder operation. So if the pain is more severe, I would highly encourage you to reach out to your surgeon to be investigated a bit more closely. The second category is mild pain that lasts much longer. Again, everyone who has surgery is going to experience pain differently. Some people may just have a longer time healing from that initial surgical stress. But if the pain is lasting a few more months, then there could be other things going on. There could be things like an infection or a hernia in that area. There could be something like a dropped stone that could be dropped outside of the gallbladder or left behind in the bile ducts themselves, and those might require additional investigations. There is a difference between pain in the incision sites, which tend to be more related to the trauma of surgery itself, and pain that's more diffuse in the abdomen that's a little harder to localize, which might be related to something internal that's going on, like a bile leak. The third category is severe pain, and especially severe pain associated with an additional symptom that you're not used to. So for example, if you've had a gallbladder operation, you're having a lot of pain, and you've got a fever, or your skin has turned yellow, you become jaundice as an example, those are signs that there's something more severe going on. If there's a pain plus an additional symptom. So if you have pain plus a fever, that could represent a bile leak. And essentially that's where we remove the gallbladder, but where it joins onto the bile ducts, there could be a leak from our clips that could happen. Or it could be an infection, and that might be the reason why you have a fever as well. Now the fourth category and final category I want to talk about is pain that's similar to the pain you had before your gallbladder was removed. And this is by far the most frustrating category of post-gallbladder pain. Most patients who fit in this category would be called post-cholecystectomy syndrome. And essentially what's happening here is you have no relief of the pain you had prior to your gallbladder surgery. Now, the number one cause of this is actually a misdiagnosis. So many people have gallstones that we really can't blame all of the abdominal pain problems that someone might have on gallstones alone. So as a surgeon, we try to ask you questions that help us correlate the gallstone pain with the symptoms that you're having. And if we can do a good job, we can have a good hit rate, and very few of our patients will have pain that isn't relieved. But up to 10% or 20%, depending on the studies you read, patients will have similar pain after the gallbladder surgery. The explanation for this is maybe it's a different diagnosis, like reflux disease or pancreatitis, for example. There's a huge variety of reasons why you might have pain after your gallbladder surgery that essentially is a pre-existing condition that wasn't identified. One of the most important things to prevent that from happening, though, is to know that you have gallstones prior to gallbladder surgery. There are situations where people have right upper quadrant abdominal pain and they're having symptoms of intermittent episodes, and it sounds like their gallbladder is a cause, but they don't have gallstones. When those patients are offered gallbladder surgery, the chances of post-cholecystectomy syndrome skyrockets. It's nearly 30 to 40% in those patients. So as a patient yourself, if you're going to your surgeon with a concern about abdominal pain and they're offering gallbladder operations, definitely discuss with the surgeon whether you have gallstones or not, because that will be the most important predictor of the successful outcome of the surgery in your situation. Now, the final complication I want to talk about isn't pain at all, and it's something that comes up from time to time. Certainly people who watch my YouTube channel have commented on my videos, and that's the issue of diarrhea after the gallbladder surgery. Again, it's not a pain symptom, but it is something that might be related to having your gallbladder removed. We say maybe 10% of patients who've had their gallbladder removed will have a short period of diarrhea, but really only 1% of patients will have longer-term problems and that require medications. Gallbladder surgery is a common operation, and the vast majority of patients are extremely happy with the results they get after the gallbladder has been removed. But there's always those patients that don't have that perfect outcome. There is no perfect diagnostic test or tool to be sure that the gallbladder operation is right for you. Only a very careful conversation with your surgeon and a careful exploration of the symptoms that you have, as well as important tests like having an ultrasound prior to your gallbladder operation. Only those things can help reduce the risk of you having an unexpected pain complication after your operation. So I'd encourage you to talk to your surgeon and have an open mind and an open conversation with your provider when they're offering an operation like this. Once again, thank you for sticking around to the end of this video. I've been talking a lot about gallbladder operations lately. If you want to learn more about what to expect after your gallbladder surgery, please click on this video down below where I take another look at this issue. Once again, my name is Dr. Rich Hills, and you're watching my channel, Knife Skills. Thank you, and have a great day.